Ladies and gentlemen, functional dyspepsia is a very common disorder affecting every one in 10 of the general population. Most common symptoms are satiety, postprandial fullness, abdominal pain, and other symptoms similar to reflux disease such as heartburn and epigastric burning. In last years, it has been proposed that one of the important pathophysiological findings of functional dyspepsia is alteration in duodenal mucosa. This alteration in duodenal mucosa was discovered to be related to increase in eosinophils and mast cells. In this slide, this is an example of increased mast cells infiltrating in duodenal mucosa. And also, you can see the significant difference in mast cells expressed as tryptase in histology in the patient with functional dyspepsia compared to control. Not only a presence of low-grade inflammation, more recently it has been reported impaired mucosal barrier function, demonstrating decreased transepithelial electrical resistance and increased duodenal permeability in the patient with functional dyspepsia compared to control. In last years, we have assessed mucosal integrity by looking at baseline impedance measurement. In the absence of a swallowed bolus or reflux, measurement of baseline impedance in the esophagus is known to be a surrogate for assessment of esophageal mucosal integrity. However, unlike the esophagus, intestinal mucosa is almost always covered by fluids, making difficult the assessment of baseline mucosal impedance. Our hypothesis was baseline impedance in the duodenum can indicate the status of mucosal integrity in health and disease, and also immediately after the passage of phase 3 of the migrating motor complex, the intestinal segment is devoid of fluids, and we could measure duodenal baseline impedance. The aim of our study was to measure duodenal baseline impedance as a surrogate of mucosal integrity in patients with functional dyspepsia. We recruited so far 11 patients with functional dyspepsia based on Roma-4 criteria, underwent ambulatory duodenal jejunal high-resolution manometry impedance for a period between 12 to 20 hours. We used a unisensor catheter, including 20 pressure sensors and 9 impedance channels. This slide shows the position of catheter, pressure sensors, and impedance channels covered from antrum, duodenum to proximal jejunum. We are particularly interested in impedance value in duodenum and jejunum. This is an example of tracing combined pressure sensors, pressure and impedance. This is a motility pattern of migrated motor complex phase 3 migrating from duodenum to jejunum. Baseline impedance before the passage of MMC Phase III was relatively lower in duodenum and jejunum. After the passage of MMC Phase III, baseline impedance increased in duodenum and also in jejunum. This is the characteristics of MMC Phase III measured in this study. The total number of MMC Phase III was 65. The number of nocturnal MMC Phase III was 38. The average duration of Phase III was 7.04 minutes. The average peak amplitude was 64.6 mm mercury. The average duration of Phase 3 to Phase 3 was 104.4 minutes. These MMC Phase 3s and all parameters appear to be within normal range. We looked at baseline impedance before and after these MMC Phase 3s. When we analyzed baseline impedance before the passage of MMC Phase 3, there are no significant difference in baseline impedance between proximal duodenum and jejunum. In contrast, after the passage of MMC Phase 3, baseline impedance was significantly lower in proximal duodenum than that in jejunum. We believe that this lower baseline impedance is important finding in this patient population. In conclusion, our results suggest that measurement of baseline impedance after passage of nocturnal migrating motor complex Phase 3 might provide a good surrogate to evaluate duodenal mucosal integrity. Lower baseline impedance in the duodenum might be an objective marker of impairment of mucosal integrity in patients with functional dyspepsia. Thank you for kind attention.